Well, hello there, caregivers. When you hear the word dementia, what comes to mind? Is it memory loss? Is it Alzheimer's? Most people think dementia is just one disease, but that's not really the case. It's actually a broader term for different conditions that affect thinking, memory, and daily life. But here's the thing, not all dementia looks the same. The symptoms, the way it progresses, and even how it impacts daily life can be completely different depending on the type of dementia your person has. That's why today I'm going to break it down. In this two-part series, I'm going to walk you through what dementia really is and the four most common types, how they're different, what to look for, and what you need to know if you're caring for someone with one of these conditions. I have met and talked with so many people, and when they find out dementia is my specialty and I start talking to them about their loved one, what I found out is that typically people think of dementia and Alzheimer's as the same thing, but they're not. Dementia isn't just one disease, it's sort of an umbrella term for all of the conditions that affect memory and thinking. And it's not just about forgetting names or where you put your keys. Dementia can change your behavior, your personality, and even how someone moves. So you might be asking, what actually causes dementia? Well, it happens when the brain cells get damaged, making it harder for the brain to communicate. And over time, this leads to symptoms like memory loss and things that disrupt activities of daily living, like getting confused about time, place, or even familiar faces, struggling to find the right words or conversations that you're having with your person. It's those difficulties with everyday tasks like cooking or even paying the bills. You might notice personality shifts, mood swings, or unusual behaviors. But here's the thing, not all dementia looks the same. The way it affects someone depends on the type of dementia that they have. That's why knowing which type of dementia your loved one has is so important because it helps you understand what to expect, how to manage the symptoms, and how to set care goals. And most importantly, how to be the best advocate for their care. Because the more you know, the better you can support them. Now I'm going to talk about the four most common types of dementia and how they're different and what you need to know to navigate this journey with confidence. So, we're going to start with Alzheimer's disease. It's the most common type of dementia. It makes up 60 to 80% of dementia cases, and it's usually what people think about when they hear the word dementia. Those early signs that you might notice are memory loss, forgetting names, forgetting appointments, or repeating questions often, losing track of conversations, or misplacing everyday items. It's not uncommon to have trouble with planning, like following a recipe or managing their bills. And just remember, the progression is different for everyone. Over time, it affects more than just memory and problem solving. It affects recognizing loved ones and starts to affect even the basic functions like eating and swallowing. You might be asking, what's the cause? The cause is abnormal buildup of amyloid plaques and tau tangles that damage the brain, making it harder for your person to function and communicate. What is the next best thing that you can do? Stay patient because routine is key. Make sure that you stay flexible and create a safe and predictable environment. Next, we're going to talk about vascular dementia, the second most common type of dementia. Vascular dementia happens when reduced blood flow damages the brain, often after a stroke or due to high blood pressure. The early signs might include having trouble with focusing, having trouble with decision making, and slowed thinking, not just memory loss. Symptoms may come on suddenly after a stroke, or they can even appear gradually over time. In the case of my grandmother, what we found was there were points in time where she would have trouble speaking, and she would go to say something and it would come out funny, or she would just kind of blank out. She even complained about loss of vision. The cause of vascular dementia is anything that affects blood flow in the brain, like strokes, heart disease, or high blood pressure. All of these can lead to vascular dementia. Helping someone with vascular dementia means that you're going to be adapting to their needs. Some days they may think clearly, while other days they might struggle. Patience and flexibility go a long way. The next type of dementia that we're going to be talking about is Lewy body dementia, the dementia that has hallucinations and movement issues. Lewy body dementia is one of the most complex types of dementia, in my opinion. Often it's mistaken for Parkinson's or Alzheimer's. The early signs can include hallucinations, seeing things that aren't actually there, fluctuating alertness. Some moments they may seem fine, while other times they're very confused. You may notice movement issues such as stiffness, tremors, or even trouble walking. The cause of Lewy body dementia is abnormal proteins called Lewy bodies that build up in the brain and disrupt thinking, movement, and sleep. Navigating Lewy body dementia means that you're going to be balancing support with understanding because predicting every change is impossible, but creating a calm and reassuring environment can make all the difference. Hallucinations can feel real. Instead of arguing, try redirecting your person or reassuring them. The last type of dementia that we're going to be discussing is frontal temporal lobe dementia, the dementia that causes personality changes. Frontal temporal lobe dementia doesn't start with memory loss. It starts with drastic personality and behavior changes. It often occurs in people under 60 and makes it one of the most common dementias in younger adults. The early signs can include sudden personality shifts, acting impulsively or inappropriately. You may notice that your person is experiencing a lack of empathy, seeming completely indifferent to everyone else's feelings. The person with frontal temporal lobe dementia often has poor judgment, making risky or uncharacteristic decisions. The cause of frontal temporal lobe dementia happens when the nerve cells in the brain's frontal and temporal lobes break down and affect judgment, emotions, and their self control. So, unlike Alzheimer's disease, the memory stays intact, but only at first. Eventually, you'll see this breakdown over time. Because frontal temporal lobe dementia often affects younger people, it can be especially challenging for families with young children. The key to this disease is managing the changes with patience. Each type of dementia affects the brain differently, which means care and treatment should be tailored to the specific condition. Knowing what to expect can help you advocate for the right medical care. Implementing strategies that actually work for your loved one's condition provides better emotional support and physical support for your person. And just remember, when you've met one person with dementia, you've only met that person. The progression of their disease will affect each person differently. If you're looking for more information or want to connect with other caregivers who understand what you're going through, join my free support group. It's a space for learning, sharing, and finding encouragement from others who are on the same journey. I would love to see you again next week, where I will cover 4 more types of dementia, including Parkinson's related dementia and alcohol related dementia. You won't want to miss it. See you next time. Bye for now.